more risk or whatever. If you get below 5%, then there's less COVID in the community, and therefore less risk. But let me just say one thing about all this, is that we've got to keep our public health measures involved, including the masks and, of course, the hand washing, the social distancing, everything that we need to do, the contact tracing and all of that needs to be done until we get the vaccine. And we got to get a high percentage of people vaccinated for that. We have to keep these efforts up until the day, that we have enough people vaccinated in the community.
Do you believe, again, with your expert opinion, I know you can't foresee, but do you believe there is a percentage in the scientific community that agrees where we can start lifting those restrictions of how many people being vaccinated?
Well, the standard is 70 to 75%. One of the things you do have to take into context, though, is the number of people that's been infected, because they have some, immunity to the virus also. So you have to take that into consequence with it. But, I would think that if we got half the community vaccinated, we would see a sharp decline in COVID in our community and elsewhere.
So when you talk about 77% of the population needing to have the vaccine in order for us to start kind of lifting those restrictions, are you including pediatrics in that percentage of our population?
Yes.
And we currently do not have a vaccine approved for pediatrics, correct?
No.
Right. So am I safe to assume that we are not able to get there as a community until that exists for our pediatric population?
Yeah, well, we're going to need the pediatric population, immunized. Now, as Helen says, they don't transmit it, as well. That needs to be taken into consideration. But I don't see the vaccine being available to them, so clinical trials have just begun until maybe the fall or maybe even this time next year. We'll just have to wait and see on that.